Hello, my name is Adrian Vilalta, and I am the first author of this study. Preterm birth, defined as birth before 37 weeks of gestation, is a significant health problem in the United States. Some key facts are, according to the Centers for Disease Control and Prevention, close to 1 in 10 infants are born prematurely. Premature infants are at an increased risk of acute and long-term health issues. Because of this, the average first-year medical cost associated with preterm birth are close to 10 times greater for preterm than for full-term infants. Importantly, about 30% of the cost takes place in the first 30 days after the preterm labor or PTL. Given the strong impact of the first few days surrounding the preterm event on outcomes and costs, we decided to evaluate the patterns of emergency transport for women with a preterm labor diagnosis. To achieve this goal, we carried out a retrospective observational insurance claims-based analysis using a large de-identified database. Using this approach, we defined a cohort of 12,995 women with a PTL diagnosis. Out of these women, 1,029, or almost 8%, required emergency transport. 977 of those received ground transportation, while 68 were evacuated by air. We also looked at how soon the women delivered their babies after a PTL diagnosis. A large proportion of these women delivered their babies within a day of the diagnosis. However, more women deliver within a day of diagnosis if they had received emergency transport. We then evaluated potential differences in emergency transport for women living in urban versus rural settings. Interestingly, our analysis revealed significant disparities in both utilization and cost of emergency transport after PTL between urban and rural settings, with women in rural settings requiring more emergency transport and paying more for it. In addition, we interrogated the database for potential differences in both utilization and cost across the United States. Our data indicate a marked inverse correlation between cost of transport and utilization across the country. In conclusion, our study showed that approximately 1 in 10 women with a diagnosis of PTL requires emergency transport. For women living in rural areas, this number nearly doubles. In addition, women with a diagnosis of PTL tend to deliver their babies soon after transport, highlighting the acute medical need. Given the large cost of transport and the risks to infants and mothers, improving preterm neonatal outcomes and containing healthcare costs would greatly benefit from improved PTL triage practices.